sometimes it's
neglect
just
them.
yes, and sometimes it's just from not having knowledge.
Well, we're looking forward to seeing some of that footage now. Thanks so much for coming in, Heidi.
Thank you.
We're here with Trevor Robson from Parbury and Robson to conduct a basic veterinary check on a horse. Trevor, what are the key points that you look for when you're conducting a veterinary check on a horse?
We call it a suitability examination, and the first thing we find out from the buyer is for what purpose they're buying the horse. And obviously if they're buying it to ride, it's got a different use. If they're buying it as a broodmare, you've got to examine different points.
Sure.
Now, the detailed veterinary examination, we examine basically every part of the horse and determine its suitability for a purpose. Now this includes from its general health, its appearance, its temperature, its conformation, the shape of its legs. Then we start at the front and work from one end to the other, where we go from the teeth to its nasal cavities, its eyes, its ears, its head, listen to its heart, its lungs, its back. Examine its legs from the bottom to the top, where we go right over the feet, all its joints, its ligaments, its tendons. We watch the horse move at the walk, at the trot. We give flexion tests to assess wear and tear in the joints, and we usually like to lunge them as well and observe their movement on the lunge. Inside it reveals all the anatomy of the leg. Some of the common conditions that horses get can include navicular disease, a common one. Navicular bone is inflammation of this navicular bone, this little bone here which sits in the back of the foot. It's mainly caused by concussion and jarring, and the best way to reduce or to prevent that happening is to only work your horses on good surfaces.
I worked as an apprentice saddle maker and got my ticket, started saddle making for myself, and that's how I got into saddle fitting. I travel around New Zealand, Australia and the US doing saddle fitting in massage clinics, teaching it, restricting the shoulder from moving. The scapula can't move, it needs to move back. There's the back of the scapula there, it will move back to here when the horse is moving. Another reason for sitting here is you should be sitting in this part of the saddle here. That's where you'd sit on the horse bareback, not up there. So those are just some reasons for the saddle not fitting as well as it should there. We can see we can just about drive a truck under there, that's way too high. This angle here is the point of the tree, which isn't wide enough for this horse, so it needs to be widened out past the outside edge of the rib cage. So if we sit that on there, we've got a big wedge of air, we've got nothing touching until here. This can sit on the horse's spinous process, on his back. It's the packing, the panel that holds the saddle up off the horse, not this being narrow, which is what was done a long time ago. So we can see the pressure that's exerted there.
And I've had horses drop their head to the ground and just let me just get into it, because he's obviously realised that this isn't such a bad hurt. See, horses can't usually tell the difference between a good and a bad hurt, whereas when we massage and they get into us and people get into our muscles, we can tell that it's a good hurt. But horses just find, it hurts, that's it, it's as simple as that. But he's actually worked it out. One of them standing there quite happily, top lips moving a little bit because he's feeling pretty good. Here we go for another yawn. Yeah. Come away from those, just come down slightly and just drag it away from the spine. And that helps to break up any of the muscle fibres that are maybe stuck together. The best thing to do is go with the way the coat goes if you're going to do lots of these nice stroking movements. The reason we go towards the heart is so that any of the toxins can be dumped into the blood vessels are going to be taken back to the heart to be cleansed by the lungs and the lymphatic system. Okay. You must remember to keep the horse's foot underneath him. Don't bring it out to the side. A lot of people bring their horse's feet out this far. You need to keep it underneath him. So take the saddle off, put it away, come back to him, hands like that, and give him a nice little rub all where the saddle's been sitting, and that will help to get the circulation in there and soften the muscles up, and it'll just feel really nice for him. You enjoy your horse all this time, you give that back, it's just priceless. This is ideal for before and after saddling up.
Try and have a smaller, more confined area for her actually to foal down in, so that you can keep tabs on the foal. After the foal's born, I think it's a good idea to check that, to stay with the mare, make sure it's had its first drink of colostrum, and make sure it's actually passing urine and faeces. I always think it's a really good idea myself to have your vet look over your mare and foal as soon as possible after foaling. Checking for discharges, make sure the foal's healthy, drinking, eating. I'd like to see the foal up and drinking within the first 30 minutes. I think it's absolutely crucial that the foal gets the adequate supply of colostrum from his mother, her mother.
Probably the most common one is the obvious thing, the low-heeled, long-toed syndrome. We get mainly those, but we see club feet, and we see offset cannon bones and misaligned legs. These are important to highlight because they cause interference when the horse is, say, galloping or travelling fast. They cause brushing and scalping and other interference problems which impair the horse's movement. And then we pack the whole with this copper sulphate, which is, we just buy that from the chemist. It's copper sulphate powder mixed with Vaseline, which makes a lovely paste. We paste it in the hole, and we find that cures it.
How long does that take?
It seems to kill it very quickly, probably within days, and then depending on how deep the hole is, it takes a while for that hole to grow out,
Right.
using the normal process of the wall growing. Some of the other problems are thrush. Thrush is a disease.
There's the second premolar, third premolar, fourth premolar. The first premolar, or wolf tooth, is a problem for any horse that has a bit in its mouth because it's located so close to where the bit will be situated. Canine teeth on... Everyone should, when they're going to purchase a horse, be able to do that. That is basic inspection of a horse's mouth. I can't stress how important it is. Making the mouth more comfortable for chewing. This poor old horse has a lot of trouble chewing simply because it has a long incisor that needs reducing. Correct occlusion enables the horse to chew right across from one side to the other on both sides evenly. If the horse is unable to chew correctly on both sides with a balanced set of teeth, it has a dental problem which needs to be.
You also need to hold the tail across, as if the tail clamps down, it will also insert the thermometer fully up the rectum. Thank the horse for his cooperation. Moving it across the hair will give you a nasty hearing. Positioning of the stethoscope is under the elbow on the near side of the horse. Push in and across. You will hear a distinct lub-dub sound, which is counted as 1 beat. You need to time for 15 seconds.